when we talk about blood cancer, it is a cancer of the blood cells, which is mainly the white blood cells. The white blood cells are the cells that help in protecting us against infection and helps in boosting our immunity. So the malignancy that affects these white blood cells is primarily blood cancer or leukemia. So the first important test that we use to diagnose blood cancer is a complete blood count. I think as a layman, people know it as a CBC or a full blood count or a complete blood count. There may be an associated anemia, which is a reduction in the hemoglobin, as well as something called thrombocytopenia, which is reduction in the platelet count. So the normal pattern of your complete blood count, the first indication that we suspect that the patient has got a cancer, and the further tests are then directed accordingly. So it is related to the functions of the cell. So if you have a reduction in hemoglobin, you may feel weak. There may be a lot of pallor. The skin may suddenly look pale. You get tired and exhausted, which can happen with anemia of any reason, not specific to blood cancer. And then if they want to know more information, what type it is, how to treat, for that we need to go for the next test, which is a bone marrow. Then there is a specialized test called the flow cytometry. So the flow cytometry test is a specialized test which will, capture each cell and tell you what type it is. So that will confirm the diagnosis of what leukemia it is. We send the sample for looking at the genes. So why did the cancer happen in the first place? Are there special genes that we can pick up, and we have some good genes and some bad genes, and which gene is present, so that I can tell you what's the likelihood of the chance of cure or control of the disease. I think it is extremely important to have these biomarkers tested at the very beginning, so that we can give you a direction as to how long you're likely to survive with this disease, or you're going to behave aggressive and you may need a bone marrow transplant very soon. It makes sense to invest in a complete diagnostic workup so that you can get the best decision plan as per your disease. Every leukemia is different, and every patient of leukemia is going to behave different. So, it is not something you can have a pre-printed plan for a patient. So everybody has to have their own plan, and that will depend on all the tests that we do in a sequential and appropriate manner.